Namaste. This is Dr. Vaishali Ashok Bhide. Today I'll be talking about thyroid disorders and its homeopathic treatment. So thyroid gland is a very important gland of the body. It produces and secretes hormone in the blood which impact each and every cell of the body. So any increase or decrease in the production of these hormones causes a great deal of symptoms in the body, and all these are called as thyroid disorders. Before we go into the details of thyroid disorders, let us first see what this gland is, where it is situated, and what are the functions of the hormones. The thyroid gland is an endocrine gland, that is, it is a ductless gland. It directly releases its hormones in the blood. It does not need a duct. So the two hormones that it produces are T3 and T4. This 3 and 4 refers to the number of iodine molecules in the hormone. So the thyroid gland, which is a butterfly shaped gland right in the center of the neck, produces the two hormones T3 and T4. These hormones play a vital role in metabolism of the body and regulate the metabolic rate. By metabolism we mean the food that we eat is converted into energy. This is called as metabolism. So this is an all-important gland because every cell of the body requires energy for its functioning. Now this very important gland has a boss sitting right here, the pituitary gland. The pituitary gland is very sensitive to the amount of thyroid hormones in blood. If it notices that the amount of T3 and T4 in the blood has gone down, then it directs the thyroid gland to produce more hormones via a hormone called as thyroid stimulating hormone, the TSH as we call it. So once the TSH is released, it acts on the thyroid, and the thyroid in turn makes T3 and T4. When the amount of T3 and T4 in the blood is optimum, again the pituitary senses it and tells the thyroid that it need not produce more. So accordingly, depending on the blood levels of thyroid, TSH either increases or decreases. Now, we will consider what happens when thyroid production increases or decreases. So basically the disorders of thyroid are primarily of two types: hyperthyroidism or hypothyroidism. By hypothyroidism we mean that the amount of hormone production is less than optimum. Hypothyroidism is much more common than hyperthyroidism. And by hyperthyroidism we mean the amount of thyroid hormones released are much more than required. Let us first see the causes of hypothyroidism and symptoms of hypothyroidism. Hypothyroidism is mainly caused by inflammation of the thyroid gland. This inflammation can be secondary to any infective agent, or it can be because of an autoimmune condition. Secondly, postpartum, which means a female after pregnancy is bound to have hypothyroidism because of a labile hormonal status. Third is iodine deficiency in the diet. As we have seen that iodine is required for thyroid hormone production. So any deficiency in the diet is going to cause deficiency in the thyroid hormone production. Now let us see the symptoms of hypothyroidism. As we know that is a thyroid hormone has a direct impact on the metabolism. So basically energy in the body. So lack of this is going to result in all the symptoms. So first, when the patient wakes up in the morning, they feel very tired. They feel lack of energy. There is even mental dullness. As there is no energy expenditure, there is weakness of appetite or low appetite. Coupled with weight gain, there is edema, that is water retention, bloated feeling, constipation, hair fall is a prominent symptom. Along with this, if it's a female, then they develop menstrual irregularities also. Usually, it is this hair fall, weight gain and constipation for which they seek the doctor's advice. Now let us talk about hyperthyroidism, causes and symptoms. Hyperthyroidism is primarily caused by two things. One is sometimes the entire gland starts producing extra hormones, what we call as the Graves' disease, and in some cases small nodules develop in the glands which are hypersecretory. They start producing more thyroid hormones than required. Secondly, again, postpartum, that is after pregnancy, it is a very labile state, so you can go into a hypothyroid status or a hyperthyroid status. And third, importantly, again as we mentioned, iodine excess in the diet. So if there is less iodine, you make less hormone. If there is more iodine, there are chances you will make more hormones. Now let us consider the symptoms of hyperthyroidism. The symptoms of hyperthyroidism are exactly opposite to symptoms of hypothyroidism. Here, because of increased hormone production, the metabolic rate goes very high, which means an engine which is to be running on 1 or 2 power is running on power 4 continuously without any adjustment of the speed. So it burns itself out equally fast. Because of this high metabolism, the patients have increased appetite in the face of increased weight loss. There is restlessness, there is irritability, there are tremors. Sometimes they can get bulging eyeballs in the later stage of the disease. Females also complain of menstrual irregularity in the case of hyperthyroidism. Their tolerance to heat reduces and they start feeling very hot. These are the prominent symptoms of hyperthyroidism. Now let us consider which people are prone to get thyroid problems. Thyroid is a hormone which has an impact on our body right from our time in utero, which means when we are in mother's womb till we die. Plus, it impacts each and every cell of the body. So basically, thyroid problems can occur in anybody, even in a child, adolescent, adult, during puberty, during middle age or during geriatric age. Thyroid problems can occur at any time. So let us consider who is at the risk of developing these problems. Familial inheritance is seen, which means if you have a closer relative with thyroid issues or if a thyroid problem runs in the family, the chance of you getting a thyroid issue is higher. Women are more prone than men. People with autoimmune disorders or diabetes or any other bigger illness also may have thyroid issues. These are the predisposing factors for thyroid. If you have diabetes, your chance of having a thyroid is slightly on the higher. Plus, thyroid is many a times often accompanied with PCOD and they all come together as endocrine syndromes. Now let us consider the treatment of thyroid disorders. Like any other illness, the treatment of thyroid disorders will be considered in 2 chapters. That is, first is lifestyle management and second is homeopathic treatment. However, here lifestyle management has a role to play only after medicines are prescribed. If you would only adjust your lifestyle without taking medicines, it would not be of much help. Now the thyroid gland is the most sensitive gland. It responds to every emotional and physical stress. Physical stress, be it a fever, any illness, surgery or emotional stress, and it starts to have a problem. So basically when the patient comes to us with symptoms which point to a thyroid problems, for the first 3 months, we do not give strong medicines and allow the gland to come back to its normal functioning. If the gland does not come back to its normal functioning after 3 months, then strong medicines are prescribed. In homeopathy, as we know it, we will take the symptom in great details of the thyroid disorder, plus personal life stresses of the patient, the emotional traumas, the strong emotions that they have felt, and accordingly a medicine is prescribed. Here the most important thing is the prescribed medicine helps the patient bring the hormonal balance back in control. We do not give any external hormones, and that is the beauty of homeopathy. The patients start making their own hormones. Once this is prescribed, patients start feeling much better. Then we see to it that TSH, T3, T4 levels are done regularly, and that is how we later taper the treatment. Now lifestyle management includes basically things which help you live a healthy life. One is morning walks or regular walks are encouraged, regular exercises, good diet, a good sleep pattern. Currently, I am practicing in Dadar West, Shivaji Park area. My OPD timings are afternoon 1 to evening 7 pm, Mondays, Wednesdays, Friday, at Park Polyclinic 5 Shankar Nivas, Dada Saheb Rege Marg, And on Tuesdays, Thursdays, Saturday, afternoon 1 to evening 7 pm at Saplace Polyclinic, Malik Building, D.V. Deshpande Marg, Shivaji Park Road number 4. You can also follow me on YouTube, Instagram and Facebook. Keep watching. Stay healthy. Stay blessed. Thank you.